I'm Carl Eggleton, who is from rural north of Auckland, and we're just going to talk about his Distinguished Fellowship today. Yeah. So welcome, Carl. It's nice to have you here.
Thanks,
Congratulations.
Thank you.
Yeah. So tell us about where you've come from and how you've got to this sort of distinguished point in your life.
Yeah, I don't know if it's particularly distinguished, but
yeah.
So I guess talking about my journey as a GP.
Yeah.
Well, I didn't start off thinking I was going to be a GP.
Yeah.
So certainly when I was going through med school, it was the last thing on my mind.
Yeah.
Was to be a GP. Matter of fact, I hated it.
Yeah, I always thought that you had to be really, really clever. Yeah.
Well, yeah, I was always going to be a surgeon, so that's what I was going to be.
Yeah.
Spent all my time in surgery and did heaps of surgical procedures when I was a med student. So I think I'd done 15 appendectomies by the time I was in 6th year.
Awesome.
Yeah.
Yeah, well done.
But then I realised, I guess, what surgeons were like, and I thought I didn't want to be a surgeon if I was going to end up like them.
Yes.
So I changed careers, or changed my pathway.
Yeah.
And trained as an ED physician was my original specialty. So I did that for a number of years in the training scheme.
Yeah.
And got a bit sick and tired of shift work and being beaten up by patients, and then decided I would go and do obstetrics and gynecology.
Yeah.
Did that for a while, and then I did a paediatric registrar job, and then I did a psychiatric SHO job, and decided I'd done everything. I might as well be a GP, and then I just fell in love with general practice.
Wow, cool. So, and where do you work now?
So I'm technically not working as a GP. My title is a Kaupapa Māori medical officer.
Oh, cool. Yeah.
So I work for an iwi health provider called Kia ora Ngāti.
Yeah.
The iwi's rohi is based from Rāwhiti in the far north, all the way down the coast, down to around about Waipu. So it's about 150k area that we have some peripheral clinics in that we go out to.
And so what's your everyday like when working in your practice?
Very complex patients normally, mostly disengaged from the mainstream primary care for a number of reasons. Sometimes it's cost, sometimes it's other barriers that they face. Often socioeconomically disadvantaged people as well, so lots of issues that we have to deal with. The other day my nurse came to see me and said, there's this client we're dealing with who's 250 kilograms and he's pretty much bedbound.
Wow.
And his bed is just given away. And he's really poor, and what can we do about that? So we approached someone in our practice who's a community support worker. She engaged with someone else, and by the end of the day we've got a new bed for him.
Awesome.
So a lot of the stuff that we do is kind of more socially based, and kind of dealing with attempting to deal with some of the social determinants of health, which is my passion.
And you've done a little bit of research, have you?
I've done some research. I guess my other job is I work as a senior lecturer at the University of Auckland part-time. So early stage researcher, I guess.
And what sort of things what things are you interested in with the research and stuff?
I guess broadly it's quality in primary care, specifically with an equity focus is the other thing that I'm really interested in. I'm doing my PhD at the moment, and that's based on looking at quality from a Māori health provider perspective.
Okay, And so what do you think, as far as changes you've been making in your practice, that have been seeing a difference for your patients that you're seeing?
I guess the things that we do a bit differently is certainly engaging with the community a lot more. So, for example, we had a community hui at one of our medical clinics that we run, and said, well, what is it about our clinic that you don't like and would like to see changed? And they said, well, I think we don't like is that when we come into the place, there's no one to welcome us, and it just doesn't feel good. So they decided they'd come up with a plan. This is the community.
Oh, cool!
That they would have some kuia sit at the front door and welcome people when they came into the clinic.
That's terrific.
And so they took over the role of being receptionists, and so they got a list of people when they came in and said who you're going to go to, nurse or doctor or whatever, and made it a real community focus. So we have, when I turn up in the morning to one of our community clinics, there'd be about 40 people there, all sitting around chatting to each other, and only about half of them actually come in to see the nurse or doctor. The rest are just there to support each other and kind of uffy each other along.
Well, that's fantastic.
So that's one thing. I guess the other thing we've been doing a little bit differently is taking a focus on long-term conditions, and we've been looking at how to help our clients lose weight. So we started up a gym program and got people to join the gym. They're all really overweight people, but their focus was on whanaungatanga, so making relationships with each other.
Yeah.
And these are people that wouldn't normally go to the gym because
I can imagine. Yeah.
hugely overweight. It's a bit embarrassing. And it was I forget its focus on fighting. So they did kickboxing and stuff against gym bags. We've had 1 year's worth of data, and every single person's lost weight. So it's 100 people who've lost weight.
That's fabulous. Really good.
So it's just kind of taking a more community empowerment focus.
And so the community, that's the sort of thing the community were wanting to do. Well, that's great. And so how often do you have your sort of community engagement hui type things? Do you do them regularly?
We don't do them regularly. So it's been our vision to do them. And so we've started off with the process of going out to the different communities and starting that. You know, that's always been what I think that general practice needs to do, is become engaged with the community more. And the trouble is, you know, GPs often don't have the time to do that, or the structures aren't set up for them to do that.
To allow it.
So I guess, you know, the freedom that I have and, you know, where I'm working, it enables me to do that. So that's great.
Well, that's great. Well, it's great that you're doing things a bit differently. I hope your PhD goes really well.
I hope so.
I did hear someone call it permanent head damage instead of a PhD, but I'm sure you'll be fine and you'll survive it. So, and congratulations on your distinguished fellowship. It's just fantastic.
And same to you, I hear as well.
Truly deserved, yes. So thanks very much. Okay.